HPV is a virus. It is transmitted through sexual contact. It is an extremely common virus, however. Unfortunately, even though someone may have had minimal sexual exposure, they're still at risk to potentially contracting the HPV virus. It is a virus for which there is no treatment, although fortunately the body's own immune system will in most cases clear the virus. It's also a very slow process by which having an HPV infection can lead to cervical cancer. The virus being present can, not always, but can lead to changes within the cells on the surface of the cervix that can ultimately result in precancerous or cancerous pathology developing there. It's also related to other forms of cancer, such as anal cancers and throat cancers, but that's much less common. We certainly get a lot of questions regarding HPV and the HPV vaccines that are available. And again, that's something that many young women and even young men are getting through their pediatrician or perhaps through a primary care provider. But we get a lot of questions about that from patients directly and from patients asking on behalf of their children. We do feel it's a very good thing to do to have young women and young men vaccinated for HPV because it is the only potential cause of cancer for which you can receive a vaccine to save yourself from that. And anything that you can do to reduce your risk of cancer is a good thing as far as we're concerned. It is a series of 3 vaccines, similar to other things like hepatitis, for which you receive an initial dose and then you come back later for subsequent doses. Receiving all 3 doses takes a total of 6 months, although if you're a little late receiving one of those doses, we can still work on that. You don't necessarily have to start over again from the beginning. Once you've gone past the age of 26, you're past the time at which it's recommended that you receive the vaccine. That's largely based on the fact that as we mature, our immune system doesn't always respond as well to vaccines. So it's not that someone who was, say, 30 couldn't receive the vaccine. It's just that the immune response and the immunity to HPV that they receive from that vaccine is not quite as good. And so the FDA just had to pick an endpoint somewhere. Now, we do sometimes have patients who request to receive the vaccine outside of the age range, and it's not a problem, it's not dangerous, it's just sometimes that their insurance won't pay for it. And so if they're willing to pay for that out of pocket, that's fine. There really is not a way to tell without obtaining a test. There are screening tests that are available to look for the HPV virus. At this point, they are almost always done in conjunction with a pap smear examination. But the reason to seek care and to seek monitoring for exposure to HPV is to catch those few individuals in which it develops into a problem. And that's why we monitor folks who test positive for HPV to continue to ensure that cancerous cells do not develop in those folks.